Now, for more on where we are as a country in the fight against COVID-19, we joined via Skype by Professor Bulie Magula, the Head of Department of Internal Medicine at the University of KwaZulu-Natal. Professor Magula, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening, Simphiwe, and good evening to the viewers.
What is your sense of where we are in terms of dealing with coronavirus?
So it is concerning that we are seeing large numbers of infections increasing every day, and the deaths that we're seeing every day increase. We are concerned about that. We did anticipate that with the easing off of the lockdown, that movement of people would come with increasing numbers of infections.
But just looking at the unprecedented rate of infections, daily infection that is, would you attribute that to, the lifting of the ban on alcohol sales?
So there's a combination of factors. The lifting of alcohol ban probably does contribute to an extent. We are seeing in hospitals large increasing numbers of people that are coming in with alcohol-related trauma, whether it's violence, stabbings, or trauma from motor vehicle accidents. And with the increasing numbers of people that are coming into hospitals, which we've been trying to avoid, there is a risk also of people acquiring infections even in hospitals. And outside of hospitals, the movement of people that is related to drinking alcohol, the loss of inhibition related to alcohol, is also, to be attributed to the increasing number of infections.
Professor, there's currently a debate raging on about the model that the government is adopting or using for projections, with the concern being that there may be an overstating of possible cases and potential fatalities. And this is why we haven't seen the explosion that was initially expected. So what do you make of such concerns? Are they genuine, or the worst is still yet to come, as some health authorities have projected?
So predictive models, by their very nature, they carry some limitations with them. It depends on the variables that are included in the models. And there are certain variables that can't actually be accounted for in the models. And they give us, worst case scenarios and best case scenarios to help with planning. So it's important to have these predictive models to guide planning. So they will, to an extent, perhaps in the worst case scenario, overstate, and in the best case scenario, not so much. So, but it's important for planning to know exactly what to expect. And in terms of the worst still being to come, it does depend on how, as South Africans, we actually respond to the problem of COVID-19. And curbing the infections, the spread of infections, because while the statistical models can tell us one thing, there is something else that we as individuals can actually do to have a situation that defies whatever it is that's been predicted by the model, purely because of how, individually and as a collective in society, we respond to this.
I mean, that's formed the basis of my next question. And as the president himself has said, that it is now in our hands to ensure that we curb the spread of COVID-19. And it does appear that health officials and the country at large have done all they could in ensure that the spread of COVID-19 is curbed, and that we don't reach the high figures that have initially been projected. So what more can be done to ensure that the curve is flattened and infections are as low as zero?
Okay, so let's go back to the government strategy on dealing with this infection. So the whole strategy was around containing the spread of infection through flattening the curve. And what flattening of the curve was meant to do. It was meant to help the health system prepare itself so that when those increased numbers of infections occur, the health system is ready. So the peak really is the height of the infections that are expected to occur. Without any intervention, that peak could have been hit very early and very fast, and we could probably have hit that peak already, and we would have dealt with large numbers of patients that the health system would never have been able to cope with. So the interventions that government put into place was to really stretch out this curve so that it's flatter in terms of the numbers of infections that we get and the height in terms of how high the number of infections would ever get to be, so that the health system can actually cope with these infections. So in terms of what it is that we can do, government has, put all of these regulations that were aimed at flattening this curve. And all the education is out, the cough etiquette, the hand washing, and it's good to see that people are heeding the call to wear masks, which is really aimed at protecting the next person in the public space, because some people may be infected and they don't even know that they're infected. So it's important that we protect ourselves. So all of these measures are there to make sure that the peak is not high, it's flat, but the virus is still there. So what can we do? When you're talking about it's now in our hands. So there is this problem that comes with this type of disease. As we see it with TB, with HIV, it's a disease that you see where the social infrastructure does not allow for reduction of transmission or for elimination of transmission. We've seen a wave initially when the infections were actually coming in, the imported infections were coming, and that wave has gone. Because it was possible to eliminate those infections. But now we have this community spread of infection that is happening in areas that are densely populated and, where people do not have the means to access food, that do not have money, that are living in informal settlements, where you ask people to isolate themselves, and it's impossible, because to isolate yourself and not spread infection to your family means that you must use your own bathroom. You must have your own bedroom and not come into contact with anybody else. In informal settlements and in areas where people do not have the means, that is not possible. So infection spread. So additional interventions really have to be aimed at
Professor,
addressing
the social. I do beg your pardon. You mentioned the peak hitting us early. I mean, when is early? Is it shortly before the winter season, which some health experts have projected that will be the actual peak, or is it much sooner than anticipated, just bearing in mind the kind of mindsets and attitudes that people have towards coronavirus?
So we almost are hitting, June, we're entering our winter season, and also the problem that we are facing is that of increasing movement. And with increasing movement, the virus is moving with people. And so this actually, especially if the social infrastructure where people are is not addressed, people, are battling, having to queue up for food and all of that, then the transmission will occur, and that peak will actually hit much sooner than, than we anticipate, whether it would be August or July. But really, it's the movement that's really going to determine just how quickly that peak is going to hit us.
Healthcare facilities are expected to be overwhelmed with the high demand of patients needing care. Are we likely to cope as a country from your analysis of the current health system that the country has?
So I go back to the question of alcohol, which from the time that the alcohol was banned, there's been a reduction in utilization of, trauma services and ICUs. So that issue needs to be addressed, and people need to be mindful of, controlling alcohol consumption. And the health system really is working. People are working very hard to expand bed capacity, general high care, as well as ICU beds. Those expansions are happening. We need also to beef up the healthcare workers and support for healthcare workers. So the rate at which the infections are occurring right now, provinces are differing. And, the Western Cape, for instance, right now is badly hit, followed by the Eastern Cape. And so how much the rest of the country is going to cope, really, we can actually see from what is happening in the Western Cape and take some lessons from there.
I mean, just reading into the kind of interventions that have just suggested that it should happen in the health system or in the health sector in South Africa. Do you reckon that the same amount of intervention and attention should be given to the education sector as the grade 7 and grade 12 learners are going back to school? Or is it just simply all systems go?
Yes. The education sector also needs to pay very special attention. As the students are going back to school, risk assessments for learners, because you might have learners that are young but have clinical conditions that put them at risk. So those risk assessments need to occur, and also measures for protection, personal protection for teachers as well as learners, and sanitation. All those measures have to be put into place. The good thing in general about children is that they are less likely to suffer severe disease that older people, especially those who have underlying diseases, have. So the challenge with children is more to do with when they return home and go back to their grannies and grandpas and hug them, so and then transmit the infection. But as children themselves, they're not really at risk of severe disease, and so precaution just needs to be taken around their contact with their grandparents who may be vulnerable, or elderly parents.
Professor Magula, thank you so much for such a stimulating conversation and for your thoughts and reflections with regards to COVID-19. We appreciate your time.
Thank you. Thank you, Simphiwe.
That was Professor Bulie Magula, the head of Department of Internal Medicine at the University of KwaZulu-Natal.